During the food price increases of 2007 to 2008, there was a lot of discussion about how the food crisis would have a bigger detrimental impact on women. And in the newspapers, on TV, you'd see lots of urban women protesting in the streets. But because the focus was so urban, we didn't really know how the food crisis affected the rural population. And we couldn't say anything about whether women were worse off than men without any hard data. So there was some evidence collected thus far, but this is based on small samples, on case studies, and they didn't really compare the same households before and after the food price increases. And either the new evidence didn't look at gender issues or looked only at women, so we cannot say anything about how men were affected as well. You can't really say anything about gender without comparing women and men. So we went back to countries where we had conducted household surveys just before the start of the food price increase to look at this issue more deeply. We wanted to know, based on the actual evidence, whether women were indeed more affected than men, and what were the coping mechanisms that both men and women used to cope with the crisis. We had detailed household surveys using panel data, observation of the same individuals and households over time in 3 countries. And we were quite fortunate we had surveys in these countries which were completed just before the food prices increased. So we were able to see conditions of the same households just before and after the food price shocks. So let's say something about our 3 countries. In Ethiopia, on average, 61% of households reported being adversely affected by the food price shock. However, on average, female-headed households were more likely to be affected by the rising food prices compared to male-headed households, 69% compared to 58%, although there was some regional variation. In Tigray, where women have higher status, both male and female-headed households were equally affected by the food price shock. But in the south, where women have lower status, female-headed households were much more likely to be affected by the food price shock. Do female-headed households experience a shock because they're female or because they have lower resources to begin with, like land and livestock? To control for these factors, we estimated the probability that a household reported a food price shock, controlling for variables like land quality, livestock, education of the head, and whether the head was male or female. We also took into account characteristics at the village level that might make households who live there more vulnerable to the impact of the food price increases. Now, even when we do this, we find that female-headed households are more likely to experience a food price shock. We also find that having large areas of land, owning large areas of land, and a higher proportion of high-quality land help to protect households against food price shocks. Households also looked for different ways to cope with the shock, but we found that controlling for other factors, female-headed households that experienced a food price shock were more likely to cut back quantity served to adult males, adult females, boys, and girls. So now that we've established that female-headed households are vulnerable to these shocks, how do we protect these groups? Well, in Ethiopia, women have weaker land rights, but these have recently been strengthened by the community land registration. The land registration has also increased the probability of adopting conservation practices that would improve soil quality. So strengthening women's land rights might help them be protected from future food price increases, both by giving them more secure rights as well as helping them to invest more in the quality of the land. It's also interesting to note that knowledge of and attendance at meetings discussing the land registration were higher when there were female members in the land administration committees. These are village-level committees. So increasing women's participation in governance bodies also enhanced the success of the land registration efforts. The food price shock was experienced by 45% of households in our Bangladesh sample and 67% in the Uganda sample. What's interesting to note is that although wives' assets account for a small proportion of the household's total assets, they do take a really big hit when shocks occur. In Uganda, for example, the food price shock reduced wives' assets and joint assets, but not the husband's assets. In Bangladesh, land and assets on aggregate were relatively well protected against food price increases, but specific assets were affected. In Bangladesh, the husband decreased holdings of agricultural durables and livestock, and households disposed of jointly held jewelry. In Uganda, food price increases reduce the holdings of jointly owned and wife-owned durable goods. Reflecting differences in country and context, dowry and wedding expenses took their toll on wives' land in Bangladesh, and illness shocks also had a large detrimental impact on wives' assets in Bangladesh. These differences in the relative impact of the shocks and their impacts on different types of assets, depending on whether these were owned by men and women, show that responses to shocks are context-specific and that gendered responses to shocks are even more so. We need to know the type of shock that affects men's and women's assets so that we can design effective social protection schemes. In Bangladesh, weather-related shocks like floods or droughts have a larger impact on men's assets, while illness shocks take their toll on women's assets. In Uganda, drought shocks affected wives' assets but not the husband's assets. So it's possible, for example, that weather-based insurance could be marketed to husbands in Bangladesh and wives in Uganda, but that health insurance might be more readily taken up by wives in Bangladesh. Designing social protection schemes should also take into account how prevalent these shocks are, how severe the impact is, and whose assets are used to cope with them. While the food price shock emerged as the most important shock for the 2006 to 2010 period, in Bangladesh, looking at a longer time period, the illness shocks were the most prevalent over 10 years between 1996 and 2006, and also most severely affected women's assets.